notification for that. All righty. So as we get started today, just a reminder about participating in Zoom. Please feel free to use the chat to ask questions throughout the webinar today. We will have a couple of chances for questions, so we'll pause then to uplift anything in the chat. And also during those times, you can feel free to ask questions by coming off mute or raising your hand. Outside of those Q&A times, just ask to please keep yourselves on mute so that we can minimize some of that background noise. All righty. So to get us started, I'll share our agenda and also take a step back and introduce myself. My name is Madeline. I'm the Care Coordination Transformation Manager at Healthier Here. And I've had the pleasure of supporting our Community Hub team as well as our CIE team and really seeing the work that we've been able to accomplish together. So really excited to be sharing with you all today. I have some other colleagues who will be joining to share some of their expertise with us around this content, so we'll welcome them in as well. And today we really hope to cover the basics of kind of the Connect to Exchange and what it means to integrate into the exchange. We'll talk about some important documents and agreements that participants will need to sign in order to participate in the exchange to share data. We'll talk about what it means to be ready to integrate and what it means if you're not quite ready to integrate. And then we'll look at some next steps and save plenty of time at the end for Q&A. Alrighty, so before I jump into content, I'm gonna welcome my colleague Catherine to provide us with a land acknowledgement.
Madeline, good afternoon, everyone. Just to start, I want to say that Healthier Here's land acknowledgement was co-developed with our Indigenous Nations Committee and shepherded by our Community and Tribal Engagement Manager. So we want to respectfully acknowledge the Coast Salish peoples whose land we are on today and whose ancestors and descendants have stewarded this land and water since time immemorial. We acknowledge that Seattle was a relocation destination city for American Indians and Alaska Natives during the termination era, which contributed to the loss of access to traditional cultural supports, economic hardships, and social disenfranchisement. Please join us in uncovering such truths at any and all public events.
Thank you, Catherine. All right, so today it is our hope that by the end of this webinar, you will understand more about what the Connect to Exchange is and what it means to integrate into our community information exchange. We hope you'll understand those documents and agreements, as well as how to use the assessment tool we've developed to address your organizational readiness for participation, as well as understand what it means to be ready to integrate and opportunities if you're not quite ready to integrate at this time. All right, so we'll jump right into what is the Connect to Exchange. And I will preface this with the acknowledgement that I know we use a lot of different language and terminology. We'll do our best throughout the webinar to define those terms and get you all up to speed on what those mean. But please stop us if you need clarification or put those questions in the chat if there's areas that we can provide more information. So when we talk about the Connect to Exchange at Healthier Here, we're talking about the technology that supports our CIE. And that technology specifically allows us to exchange information across sectors and across organizations, specifically with the purpose of improving care coordination. And Healthier Here's, again, technology to do so is called the Connect to Exchange. And I also want to emphasize that, by joining the hub as a case management partner, all case management partners will be connecting into the Connect to Exchange in one of two ways. And that is specifically either adopting the Connect to Coordinator client management system, which is the platform that we offer for the Community Hub case management work, and which itself is already connected into the Exchange. Or the other way that you can get connected in is through integration, which means connecting your existing client management system into the Exchange to share data that way. And when we talk about existing systems, we're talking about that platform that you might already be using to do some care coordination work, whether that's Credible or Epic or Apricot or any other number of the systems that are out there. So when we talk about integration specifically, we're talking about connecting your existing system into our Connect to Exchange so that we can bring together that data from different sources to create a really seamless record. And that record can include information like service directory, so you know what resources are out there that you can connect your client to, as well as that client information around potentially their demographics or their referral history, the information that really allows you to care for them as a client. And so by connecting the data from your system into the Exchange, we are hoping that will help you better work together across systems and organizations in service of supporting your client. And we do that by reducing those data silos and kind of promoting those efficiencies. And it's our full intention that not only is this to benefit you as care coordinating agencies, so that you can better communicate with one another, better access services and information, but it also is a huge benefit to the clients that you're serving, in hopes that they don't have to share the same information over and over again when they're moving from, let's say, their behavioral health provider to their primary care to their case manager at their CBO, because everyone has that access to the data that they need to serve the client, and we can avoid asking them the same thing over and over and avoid some of the re-traumatization that can come with that when it comes to social care and social needs. So we really see this as a benefit in both ways to agencies and to community in general. So this slide is just a visual representation of what we're talking about. It's a lot of technical terminology, and as a non-technical person myself, I think visuals really help kind of put some of the pieces together about what we're talking about when it comes to data and the exchange of information. And so this visual really represents what exchanging data through the CIE looks like in the case of case management for our community hub. And so what you see here is in the circle, you'll see the functions of the Connect to Community exchange. The arrows on the sides represent the flow of data and information. You can see they go both directions. So data is flowing into the exchange and out of the exchange. On the left-hand side of the screen, you can see various community hub case management partners represented. On the lower left-hand side here, we have some partners who are connected to the exchange through using Connect to Coordinator. So they've decided to adopt the client management system that we're offering to do case management work for the hub, and that's how they have access to the data and functions of the exchange. When you look at the top left here, you see the case management hub partners who've decided to use their existing platforms. For example, Vision Link or Unite Us, they've said, we like the system we're using, our care coordinators know it, they're familiar with it, and we want to go with that. And so they have access to the exchange through an integration. And you can see that regardless of however you're plugged in through integration or through using Connect to Coordinator, you have access to that data and the functions of the exchange either way. Now, when you look at the right-hand side of the screen, you can see the other providers you might interact with to provide case management services. So these could include, both clinical providers or social service providers. And if those providers are also connected in the exchange, then you can send and receive information to and from them through the exchange technology in service of connecting your clients to resources, sending referrals, viewing care team information, and the like. So you get access to, again, all of those functions. And I do want to emphasize that most of these functions are currently available in the Connect to Exchange. Shared care planning is something we've been working on, but is going to be a future state offering. The rest is currently up and running and available to our partners. So when we talk about integration, which again is one of the ways you can plug into the exchange, the other is adopting Connect to Coordinator, which when you adopt Connect to Coordinator, you get up and running on that platform and you're ready to go. Integrating your existing system takes a few more steps. And so when you choose to establish that bidirectional exchange of information, for purposes of the hub case management, we want to make sure that you can exchange and also receive information related to the status of client consents, their care team information, and that referral history information that really will enable you to do that case management, that full scope of case management for the hub. So what that looks like is, as a case management partner, first, you will sign a participant agreement and data sharing or a business associate agreement if that applies to you. And we will go into more detail on what those agreements look like, but just making sure that you're protecting that data and privacy of clients. Once you're up to speed there, we will get connected through you to your IT vendor, whoever that is that supports you in using your existing system. Maybe it's Epic, Apricot, etc. And we will work with them on an approval for exchanging the data. Then we'll work with that vendor to do what we call a data mapping process. And what that looks like is really figuring out the translation of getting the data that exists in your system and pulling it out and putting it into another system. And that's really the beauty of what the Connect to Exchange technology does. So we'll work on that data mapping process and make sure that what you're seeing on your end and what you're sending out looks good and supports you in doing the work that you want to do. And then we'll work on a data and workflow for integration, and we'll end by sort of defining how to manage on an ongoing basis that data flow, any data errors that might come up or duplications, and security requirements. And so we'll kind of establish what that looks like on an ongoing basis. So a few steps that we'll go through. Healthier Here would be walking you through all of these steps along the way. So you'd have our full support in that. And we'll get into more of those details later on. So before that, we'll talk a little bit more about our documents and agreements. As we shared, the kind of vision for the Connect to Exchange and what it's capable of is fantastic in terms of sharing data, all getting on the same page for the purposes of care coordination. And it's the exchange of often sensitive client information around, their social or health needs. And so we at Healthier Here take it very seriously, to make sure that we have what we need to have in place to protect the privacy and the data of the community and the clients that are being served through the exchange, to make sure that we're maintaining that trust and fidelity with our community. So to walk us through some of those details, I'm going to invite our privacy officer, Alexis.
Hi, happy Friday, everyone. So like Madeline said, one of the big pieces that this network and this exchange spent well over a year on was what we call our privacy framework. And some of the forms and tools we're going to go over today are a piece of that framework, and something that Healthier Here really cares deeply about, and we know is a linchpin in terms of the ability of a network like this to work, or an exchange like this to work, is trust among those organizations that are participating and exchanging their data, as well as trust between the community members whose information is being stored and exchanged in this type of technology. So long before we even had a technology vendor, we were working very hard with our community partners and community members on this privacy framework, since we knew that was the foundation to any of this working effectively. So we're going to run through a few of the forms and requirements. This is just a high level review. So there are going to be office hours, which will be mentioned later, but we know that some people will be more familiar with these types of documents and agreements. Some people or organizations, this might be newer and you might have more questions. So this is just a high level overview, and then there will be more opportunity to dive deeper later on in the process. So the two pieces we're going to be going over today is the client authorization form, which I'll talk about. And then the two other big pieces we're going to talk about are what's called the participant agreement. And that's the agreement between the exchange and participating organizations, as well as a data sharing agreement. If you are a covered entity under HIPAA, which might apply to a few organizations in this call, but not all, we also have a business associates agreement that we would swap out instead of the data sharing agreement as appropriate. So we do have a pre-agreement self-assessment tool that we'll be going over, but it will cover both that participant agreement and the DSA as well. Okay, next slide. So as you all know, client authorization and consent is extremely important in this process. And when we were developing our privacy framework, the importance of having as much transparency and having this be an informed consent process was very important, not only to Healthier Here, but to all of our partners as well. So a few of the pieces of information that are included in the exchange's client authorization form indicates to the client that they do actually have a choice in whether they provide consent for their information to be shared and stored and used in these ways. It provides plain language around what information is being collected and shared. It also reviews who will receive the information, why the information will be shared, and what it will be used for. And also includes an expiration date so that the person has an opportunity to renew their consent. And there's also information on there, I know it's not listed on here, about how if they change their mind, they can either re-consent in if they declined before, or if they signed the consent form, how they can remove their consent so that their information is no longer stored or shared in the exchange. So if we could go to the next slide. And Madeline will be sending out these materials, but as you'll see in the client consent, we did a lot of work to make sure that it was accessible as plain language as possible, so that it wasn't just some long legal document that people wouldn't even read and then just feel like they had to sign in order to receive services. So we were really mindful about making it a genuinely informed consent process as much as possible. So we're going to be discussing what we're calling a pre-agreement self-assessment tool. As I mentioned, some of you might be really familiar with information or data sharing and exchange. And so This might be something that you've done many times. You've signed similar agreements or documents. You already have all your policies in place, those types of things. So you likely will be able to breeze through this tool. But if you are someone or at an organization that this is going to be a newer practice, we wanted to have something that basically summarized what those requirements and expectations are of anyone participating in the exchange, so that we can all move forward knowing that we're all being stewards of the data in the same way that everyone expects us to. I apologize. My kids are playing in the background, and for some reason they're playing in sync, which I'm not opposed to, but it's probably not going along with what we're talking about. So what this tool is it's an opportunity to help organizations assess whether they have or need to develop the policies and procedures that are going to be required for them to be compliant with privacy protections. And you will see us refer to HIPAA in this description. That does not mean that your organization has to be a covered entity or a business associate or really anything in a formal sense under HIPAA. But as many of you already know, HIPAA is in a lot of ways seen as information and data privacy and security best practice. And as an exchange and as a network, we wanted to be as strict and conservative as possible to ensure the security and privacy of the information we were being trusted with, and also wanted to enable free sharing between participating organizations, so there would be less siloing within the exchange, as Madeline was talking about earlier. The goal is to break down those silos, not create more. And so in order to do that, you'll see that the privacy and security requirements do align with requirements that you'll see in HIPAA, somewhat in FERPA. I know there's a lot of different privacy and security laws out there and expectations. So we did our best to be inclusive, but I'm sure we missed a few things. What this tool is not, it's not a legal document. So this is not a substitute for your organization working with their legal counsel to understand what your liability and responsibilities are, and what the expectations are. So this is not the end of a process. This is the beginning of the process. This tool is also not specific to an individual organization. So again, there's going to be contexts that influence things. And so really taking the time to fill this out and ask questions that are specific to your org. Healthier Here, we're committed to providing support for case management partners. And we do, in order to support that, we do have policy and procedure templates available, and they're going to be made available free of charge for case management partners. If we share those with you, you're not required to adopt them as is, but they're a great starting point if you are an organization that doesn't have these policies or procedures, or maybe you do in terms of your workflows, but they're just not documented in a formal manner. It's just really helpful to have a starting point. And we are willing to share the templates that we've developed with our case management partners free of charge. So if we could go to the next, I've already talked about this a bit, but there are 2 required agreements that any participating organization are required to sign with Healthier Here. The first one is called the participant agreement, and this is the contract that outlines our terms and conditions that governs the relationship between the participating organizations that are using the information exchange. And so this goes through a lot of the responsibility, liability, expectations, things like that. The data sharing agreement is a contract between Healthier Here and a participating organization, and it gets more in the weeds in terms of defining the terms and conditions under which the data itself will be shared within the CIE. So this gets a bit more detailed in terms of privacy and security requirements, breach reporting requirements, again, responsibility and liability, things like that. So it gets more into the weeds around that. As I mentioned, that we also have a business associates agreement, if that's applicable to your organization. The terms and conditions within the 2 documents are very similar, but it has more to do with your relationship to HIPAA as a covered entity or business associate, and less so a difference within terms and conditions. So next slide. In terms of the participant agreement that I mentioned, a case management partner is required to collect consent from a client and have the policies and procedures specific to how to capture that consent, store the history of that consent, and how to handle if someone decides to revoke or take back their consent. The organization must also have policies and procedures related to data privacy and information security, and there's more detail in terms of what that entails in the assessment. You must keep an inventory of all your devices, and that includes tablets, that includes laptops, smartphones, and systems that have access to your client data, and all of the people and organizations who also have access to that data. You must have policies and procedures to guide how equipment, systems, and software that collect or store personal data can be securely accessed and properly used. So these are things like confidentiality policies, appropriate data use policies, things like policies regarding not sharing your login information with other people. Some of it gets to really basic stuff, but it's all about protecting that information. You also must have policies and procedures to protect the client information. And this often, this does include information privacy and security training for all of your staff or volunteers, interns, anyone who's going to be entering or using the client data. Finally, there are some specific IT requirements regarding firewalls and malware detection. I know for most organizations or many organizations, their client data is stored in electronic forms that are connected to a network or the internet. And so this is pretty universally applicable. And finally, having policies and procedures regarding client data retention and destruction as well. So next slide. In terms of the DS or the data sharing agreement or DSA, the partner is going to be required to ensure that all staff and volunteers that have access to the exchange have completed HIPAA training. Partners must also keep records of when that training is completed, and it also must be renewed on at least an annual basis. You need to have a policy and procedure that addresses the documentation and secure storage of any written client authorizations or revocations in order to be in compliance with the network. You're going to need to have a policy and a procedure to immediately notify Healthier Here of any client requested restrictions, revocation of authorization, or client request to access. So that is in regards to if someone changes their mind regarding what pieces of information they're comfortable with having in the exchange, if they decide to pull their consent entirely. It's extremely important and required that get to the exchange so that we can implement it and respect the person's request. And then finally, ensure contracts with third-party IT or third-party vendors, such as if you have a third-party IT vendor who might be accessing Connect to Exchange, that they comply with the information security and privacy standards, practices, laws, and regulations that are detailed in the data sharing agreement. Next slide. I think that, okay. That was a lot. Like I said, it's the tip of the iceberg, and we have documents that we'll share with a lot more detail. And also we'll be hosting office hours to answer any questions that anybody might have.
Yep. Thank you, Alexis. Really appreciate it. And yes, please don't feel that you were expected to memorize everything just shared. That was a brief overview, and the documents with all of the specifics will be sent out early next week following the webinar. So we're going to pause there. We have some more content, but want to just take a moment to see if there are any questions. We'll start with any that have been posted in the chat.
I want to highlight the question that Sarah put in the chat, asking if clients are consenting to sharing data with specific providers within the network or with the entire exchange.
So that is an excellent question, and we already had a discussion about this the time that we were developing the privacy framework. And what we settled on is that because the participants in the network and the exchange are likely to change fairly frequently, especially at the beginning, they will be consenting to sharing data with any providers that have signed all of their required documents that I just reviewed. And we will be posting once an organization signs that participant agreement and the DSA, their organization name, logo, and a link to their website if they have one will be publicly posted on the Healthier Here and the Exchange website so that it's publicly available to anyone that is interested in seeing who is currently an active participant in the network. But the consent itself does not list specific organizations.
Thanks, Alexis. And I think that was your question, Sarah. Did you have a follow-up? I see your hand up.
I actually had a tangential question, so I'm
Okay.
happy for you to come back to me if you want to take the other folks who
Go
were
for it.
Yeah, I want to say first of all, I really appreciate the leadership you all have taken in this arena and the making the agreements and stuff available to other organizations. I think that's fantastic, and I'm curious about whether you all have any resources to provide TA to organizations who may not be in a position to comply with all of these requirements at this time. And then also sort of as an aside, we've been trying to find essentially an organization to provide TA to help us do this kind of stuff. And so I'd be really interested to chat with you all if there's if it's not you, like if there's an organization you would recommend.
That's a great question. Thank you, Sarah. We'll be talking about what capacity building will look like in a few minutes. And what it'll look like if you do need support to kind of get up to speed with some of these requirements or the infrastructure needed to protect data and privacy. So there will be support if that is the case. So we'll get into that in a little bit. The details of what that will look like are still forthcoming. All right.
Thank you.
Yeah, no problem. Any other questions in the chat, Olivia?
Yes, we have another question asking, is there a data minimum to integrate, and do we and our clients get to choose what information we share?
Wendy, I don't know if you're able to comment or maybe put more detail into the chat, but I'm curious what you mean by data minimum. Are you referring to a specific list of fields that are required or a number of records?
Yeah, it was specific fields that were required, not number of records.
Gotcha. Yes. So there are required fields within the data model for the exchange. There are not very many, and we did that purposefully. The required fields relate really to being able to identify records and individuals so that their information can be connected to the correct record. We can get into more detail either at an office hour or if you want to reach out specifically about the specific fields in the model that are required versus optional. So I would say, yes, there is a data minimum, but it's a fairly low threshold. And in terms of deciding what information can be shared or not, that occurs on the consent form and is not field by field, but is more clustered by someone can opt out of sharing mental or behavioral health information or HIV status. There are specific types of information that someone can opt out of sharing with us, but it's not like a field by field of yes, this is okay, no, this is not okay.
Okay, thank you for that. Can I ask a follow-up question about that specific?
Yes, of course.
There, yeah. Are we as an organization then going to need to make sure that that consent of which fields to share is kind of maintained. I mean that like if we get the consent that says, okay, we're not going to share behavioral health information, does our integration system need to make sure that that is not shared with the exchange, or does the exchange then maintain that consent, those specific consent pieces? Does that make sense? In terms of how we're setting up the integration.
Yes, so part of how you'll set up the integration, and Rim, I see your hand up, so you might have a good response to this as well. The consent management is an extremely important piece of setting up any integration. And so in terms of keeping that consent updated, that is the responsibility of the case management or any of the participating organizations. So accurately entering information on the consent that was provided by the client, and then updating that if it changes is the responsibility of the participating organization. In terms of the consent management within the technology, our vendor does have, we've worked really closely with them on the consent management protocols. And in terms of, some of it depends on if you're using the Connect2 coordinator platform itself, if you're doing an integration, there are nuances there, but in general, the client to organization management of the consent is handled by the case management organization, and then the technological piece is handled by our platform, although there needs to, in terms of an integration, your system needs to be able to tell our system the nuances of that consent management, if that makes sense.
I think it got me there. Thank you, Alexis.
Yep. And Rim, I just see your hand up, so I want to make sure that we get to you.
Yeah, I just wanted to add just a little bit of color to Alexis's response. First of all, on minimum data, to give you an idea, the minimum data we're talking about is that if we don't have a client's name or birth date, or we don't have contact information, then we can't reach the client. So we're really talking, when she says minimal data, it's very minimal, just so that care coordinators can actually do their job. And along with that, clients can always decline to share information, and that it says that in the authorization form. So if the authorization would allow us to collect certain information and they don't want to answer those questions, they're free not to answer those questions. The other thing on the integration side that I would add is our preference would always be that you not send us data that the client hasn't authorized us to collect, use, and share. However, if you do, as Alexa said, we have the controls that we will drop it in the interface and not store it. But our ask of your vendor is always, don't send us things that the client hasn't authorized you to send us.
Thank you, Rim.
Thanks, really appreciate it. I know there's a couple more questions in the chat. I'm going to keep us moving just for the sake of time, but I want to invite the Healthier Here team who's on the call to maybe respond to those questions directly in the chat, so we can make sure those get answered. But for the meantime, I'm going to keep us moving and invite my colleague Bello to share what it looks like for an organization to be ready for integration.
Thank you, Madeline. And folks, thank you so much for all the questions. This is really important to get us into a good space to integrate. I hope over the next 2 slides, I can give you a little clarity on our overview of steps that we take to really get a good partnership established between us and you, so that integration can go smoothly. So for planning and implementation, we'll look at some high-level conversation points that we'll be exploring. In planning, we really take the approach of 2 steps. The first is, what functional requirements should we make sure we consider? And then the second is, what technical specifications do we need to make sure we align on? I'm really happy to see some of your questions coming in are already addressing both. So thank you. And I really love that excitement you bring to the work. in functional requirements, we're really talking about what does the partnership look like? Is there the minimum requirement data fields that we're hoping to at least integrate on so we can pull up a client through the exchange, for instance? And what's the matching criteria for those fields as we build? This is really where we're focusing on answering your questions in detail about those data points that we're going to need to have established in order for the integration to be successful. Of course, consent has been coming up a few times. This is critical because for the exchange to be designed appropriately for the community's needs, we would definitely need to make sure consent is forefront for every integration. And then also, even for folks adopting, that the client information they're accessing is consented by the client. So we spent time in reviewing the consent model with you to make sure if there's any questions or considerations, we take them into play before proceeding with integration. Now, the biggest part is, for the techies on the call, I know you're all thinking, how much work is this going to mean for me and the team? And then, of course, for the people you support, what does this mean to the work they already do? We spent time in change management and actually thinking through the impact to your team. And then, of course, what it means to make sure folks' work isn't shifting dramatically as a result of integrating it in exchange. As you all know, adopting yet another tool would be the workaround for all of us to make sure we can share information, but that's not the purpose of an interoperable exchange. So we make sure we consider change management to your team. All of this, if done correctly, should get us to a good place with the agreements we put in place and also a good definition on the resourcing, meaning from Healthier Here to your team and also from your team to make sure on the contract terms to integrate, we have them all outlined so that we know who owns what and how do we support each other to proceed with the integration. The functional requirement piece might take some time because this is bringing in a lot of folks whose voices need to be heard, from leadership all the way to frontline. So we would spend a lot of time there, making sure everybody is comfortable with the pace we're going and the direction we're headed. However, the technical specification piece can go fairly smoothly. And I say that knowing that the technical assessment piece is mostly supported by our team. Our vendor is on queue, ready to go as soon as we have contract in play to work with your team, either the system admins internally or your vendor team, to make sure the data we want to share is assessed and is actually quality data that might be beneficial to the exchange. Of course, there are data standards for quality and assurance that every system puts at play, but we want to make sure we review so that it follows across the integration path so we don't muddle up the exchange information on Connect to Exchange. Now, part of this exercise is the data model that we will share with you. For the exchange currently, our data model and dictionary has been going through intensive review since the past 2 years. I think Alexis has touched on that. So making sure you're in alignment with that and any data changes that we might need to make. Perhaps you hold data that we haven't considered, including in the client profile for the exchange. So we spent time looking through the data dictionary and the data model we have at play to make sure all of the fields we want to align and map over to your system will be successful. All right, this is the fun part where I think, Madeline, you had moved on to the next step. To actually build the specifications for the API, it's all about currently standing up or building against APIs that you might already have in place. Now, for us, this might look or take the shape of 1, maybe 3 APIs that we might be plugging in terms of endpoints to your system. That is to say that sharing client information is different than sharing the referral loop, and that's also different than sharing resource directory information. I remember Sarah asked the question earlier, about, well, does this mean I can build one API to integrate with the exchange as opposed to building multiple APIs with multiple partners? It means exactly that. However, the one API with the exchange could take shape of multiple plugins and endpoints that might correlate directly with the resources we're hoping to share with your system. So a happy state for all of us in the integration path looks like testing and validating each of these integration endpoints with your system. So we don't leave you to do any of the work on your own. Our internal team will be walking with you step by step, all the way through the planning, through validating the integration. And we also plan to continue collaborating with you afterwards to make sure there's quality assurance. So I hope this gives you a little bit of an idea on how we plan to walk through the integration stages. And then, of course, things do go wrong because this is systems that we're integrating and they're all different. So we monitor error handling on our end. And when things do go wrong, we then follow up with you to make sure we solution accordingly. I'm going to pause here. This is the 2 slides I hope to share, but I'm sure there's some questions we probably want to address.
Thanks, Bello. I think I'm going to take us through just the information around alternatives to integration, because I think it might answer some questions folks have. And then if anything's lingering, we can use the remaining time for that. So thanks for your help, Bello. And as it relates to integration, we know for the hub case management that things will be starting for the first round of partners in July. And so we know that this is a lot of information to take in and that some folks might not be ready to do this integration process either by July or perhaps even later. So we do have some alternatives and we're committed to supporting you in whatever way that you can and want to participate as a community hub partner. So when it comes to case management and integration, if you're not ready, or maybe you're not interested in integrating your existing system, certainly you can adopt the Connect to Coordinator platform to be ready to go by July. Additionally, if you decide that maybe you just don't have the capacity right now, you can adopt the Connect to Coordinator platform and consider integration of existing systems at a later date. If even that is a little bit too much for you right now, please keep in mind that we'll be having additional case management cohorts on a rolling basis as needed, probably around every 3 to 6 months. So if right now is not the time for you, there are future opportunities. If your primary gap around readiness relates to policies and procedures, please feel free to adapt Healthier Here's resources and templates if that's what your need is to get you ready. If your needs are more so around the infrastructure that it's going to take to support privacy and data sharing or technical capacity, there's an opportunity to build your capacity up in what we're calling a capacity building cohort. And that's going to be, a group of other folks who want to participate as case management partners who also need to build up their capacity and infrastructure. And so we'll create a cohort probably starting in Q2 or Q3 of this year, and really lean into supporting you to getting you what you need to be ready to participate. Again, like case management cohorts, it's not going to be a one and done opportunity. So there will likely be future capacity building cohorts. And those we're anticipating to run within the realm of about 6 months. So plenty of opportunities to participate with us. If you're thinking of or noticing barriers, please talk to us about what the right option is for you. We know that all of your organizations have so much to offer by way of the Community Hub and for our community. So we want to work with you so that you can participate and that we can collaborate. What you can expect from us is a follow-up email after this webinar. I will include the recording and this slide deck, as well as all of the agreements and documents that we talked about today, including the client authorization or the consent form, our participant agreement, our data sharing agreement, the business associate agreement, if that applies to you. If it does not, please feel free to disregard that. And then that pre-agreement self-assessment, which really just helps you walk through a sort of checklist to assess your readiness as it relates to data sharing and the participant agreement. We will host office hours the week of February 12th to just allow folks to drop in once you review some of these documents, or if you have lingering questions, please come and we'll have some Healthier Here staff there to answer those specific questions. Or if you want to just join to learn from the questions of others, you're also welcome there. My colleague Olivia will be putting those registration links in the chat, and they will also be in the follow-up email if you'd rather register then. So with that, I want to close us out. I know we've got more questions rolling in, so we'll stop here and take the remainder of the time to answer questions.
Before I paste the links into the chat, I just want to say that there's no, oh, actually there is a new question that just came in, sorry. One question is, what interface do you use between our system and the exchange?
I'm gonna let Rim answer that question.
So I may need a little bit more clarification on the question. We have a set of standard interfaces that can be used for Exchange, but our vendor has the tools to customize those connections in any way. Most of the time, we ask you what your technology can support, and we adapt to that. There isn't any standard technical, any single technical standard that we require for use.
Thanks so much, Rim. From Whitney, Whitney is thinking it would be really helpful for us and maybe others to have a list of client record systems that other case management partners are using who want to integrate. Just wanted to lift that up.
Yeah, that's a great question, Whitney. I think we could probably put something together when we know more, because we haven't rolled out the RFA. We don't know exactly who the case management partners will be and what systems they're using. We can share that we've heard from interested folks that there's a variety of systems, including Apricot, Epic, Credible, and others. So there's a variety, many of them come up multiple times. But I do want to emphasize that, if an organization is using a unique system, or just because it's not widely used won't preclude, an organization from integrating.
Another question has come in asking, will demos include current active integrations with various platforms like Unite Us or Epic?
I'm sorry, can you say that again, Olivia?
Yeah, of course. Also, thank you everyone for the great questions. Will demos include current active integrations with various platforms like Unite Us or Epic?
Oh, I see. So the demo, I think if you're referring to the demo that we're holding on February 12th, that will just be a demo of the client management system. It won't, I don't believe we're intending to include any of the integration components. But if you're interested in learning more about that, we could probably connect with you one-on-one, Dylan.
Those are all the questions in the chat, but would anyone who has a remaining question like to come off mute and ask your question?
Okay, I think that might be it for us today, just in the nick of time. Really appreciate everyone's participation today on your Friday afternoon. Um, we're really excited about what's to come for the Community Hub and for our CIE, and excited to collaborate with you all on this. Please look out for the follow-up email, likely to come on Monday. Anyone who registered will get that with all of the materials. And please feel free to forward to other colleagues you think need to be in the loop. And we will see you all for office hours. And please join also for the demo coming February 12th if you're interested. I'll put details for that in the follow-up email, but you can get a inside look on Connect 2 Coordinator then. All righty, take care, everyone.